The COVID-19 pandemic increased childcare and household demands of families with young children through daycare closures and stay-at-home orders during a time when several stressors were introduced, including fears of COVID-19 infection, financial insecurity, social isolation, and disruption of previous routines, raising concerns of increased suicide deaths. Recent studies suggest the pandemic has exacerbated existing gender inequities in childcare, employment, and housework. For example, women were more likely to take leave or reduce their work hours due to lack of childcare than men. This is likely due to gender roles that pressure mothers to serve as primary caregivers while successfully balancing family and work needs, increasing their parental stress relative to fathers, suggesting the pandemic's impact on parental mental health may differ by gender. Our objective was to examine differences in diagnosed suicidality after the onset of the COVID-19 pandemic between mothers and fathers with young children under age 5. Using de-identified National Administrative Healthcare data, we conducted an interrupted time series study to estimate changes in monthly diagnosed suicidality rates after March 2020 between mothers and fathers with young children under age 5. We included biological and non-biological parents with at least one dependent child enrolled in the same employer-sponsored health insurance plan for at least 30 continuous days between January 1st, 2016 to the end of September 2021. To identify parents and any dependent young children, we use a subscriber number or family ID shared by multiple individuals enrolled in the same health insurance plan. Among those with the same family ID, we then identified individuals ages 26 to 64 as parents and individuals younger than age 5 as young children. We use generalized estimating equations to fit a series of logistic regression models, clustering at the enrollee monthly level. Our final model included the main effects of parental gender, COVID-19, and time, all two-way interactions among parental gender, COVID-19, and time, and a three-way interaction term of parental gender, COVID-19, and time. The unadjusted and average predicted monthly rates of diagnosed suicidality by parental gender are shown in Figure 1. We adjusted for age, race, ethnicity, census region, and enrollment month. Among mothers, we found an average monthly increase of 0.27 suicidality diagnoses per 100,000 from January 2016 through March 2020, which rose to 0.51 per 100,000 from March 2020 to September 2021, resulting in a slope or trend change of 0.25 suicidality diagnoses per 100,000 mothers. In other words, compared with the average predicted monthly rate of change in diagnosed suicidality among mothers before March 2020, there was an additional 0.25 suicidality diagnoses per 100,000 mothers every month after February 2020. This can be seen in Figure 1, where the slope of the green line after the vertical break in March 2020 is steeper than the slope before March 2020. Among fathers, we found a similar average monthly increase of 0.28 per 100,000 before the onset of the pandemic, which didn't change significantly from March 2020 through September 2021. Our main finding is that compared with the average predicted monthly rate of change or slope in diagnosed suicidality between mothers and fathers before March 2020, we found an average predicted increase of 0.3 suicidality diagnoses per 100,000 mothers relative to fathers every month after March 2020. We can spot this visually in Figure 1, where the slope of the green line for mothers is steeper than the slope of the red line for fathers after February 2020 compared with the slopes of both parents before March 2020. These findings highlight the gendered impact of the COVID-19 pandemic on mental health among parents with children under age 5. Compared with fathers, mothers were diagnosed with suicidality at a greater rate after the onset of the pandemic. Although stay-at-home orders and closures of schools and daycare facilities increased childcare burden for all parents, mothers assume more of these responsibilities than fathers, which may have increased their stress and risks of anxiety and depression. As more childcare facilities reopen and in-person encounters occur, it is critical to continue monitoring how the evolving nature of the pandemic impacts parental mental health, especially among mothers.